Pynes, the Director of USF Master of Public Administration Program. This evening's event is jointly sponsored by the Suncoast Chapter of the American Society for Public Administration and the USF Master of Public Administration Program. The event is divided into 2 sessions. In the first session, we will have a guest speaker followed by panel discussions and questions and answers. In the second session, we will be inaugurating our new MPA Alumni Ambassadors, who will award scholarship, and finally, induct qualified graduates into Pi Alpha Alpha, the Honor Society for Public Affairs and Administration. But before we get started, I would like to recognize a few dignitaries. We'll begin with the MPA Advisory Board. First, we have Bobby Green, the City Manager for the City of Avondale and the Chair of the Advisory Board. Carl Harness, Chief Human Services Administrator for Hillsborough County and the Deputy Chair of the Advisory Board. Dan Biles, County Administrator, Pasco County. Brian Colley, Supervisor of Elections, Pasco County. Bill Horne, City Manager, City of Clearwater. John Lewis, County Administrator, Sarasota County. Katie Parkinson, Chief Operating Officer, Senior Connection Center. Otis Lehola, Operations Manager, former Operations Manager, Public Works Department, Hillsborough County. Mike Suarez, President, Suarez Insurance, and former Councilman, City of Tampa. Al Braithwaite, City Manager, City of Oldsmar, and immediate past President of the Suncoast Chapter of the American Society for Public Administration. Dan McDonald, Police Officer and Homeless Liaison Officer for City of Tampa. Sean Cyrus, City Manager, City of Lakeland. Jill Silverboard, Deputy County Administrator and Chief of Staff, Pinellas County, and she is also our guest speaker for tonight. Louis Vera, Council Member, District 7, City of Tampa. Brandon Henry, President, USF student, USF ICMA Student Chapter. Daniel Lang, President, USF ASPA Student Chapter. And we also have the new officers for the Suncoast Chapter of the American Society for Public Administration. These are Dr. Spina, President and retired City Manager for the City of Zephyrhills. Emily Colum, President-elect, Assistant City Manager, City of Lakeland. Troy Salisbury, Secretary, Planning Manager, Hillsborough County. Garrett Zelliff, Treasurer, Finance Administrator, City of Oldsmar. Al Braithwaite, immediate past President and City Manager for City of Oldsmar, as I mentioned earlier. In addition, we have the following officers of the chapter. Dexter Badge, Assistant County Administrator, Hillsborough County. Jessica Blazer, Fiscal Services Director, Pasco County. Joe Gross, Code Enforcement Director, Hillsborough County. And last but not the least, Krista Remington, Assistant Professor, USF School of Public Affairs. Now, I have the distinguished honor of calling upon the Director for the USF Master of Public Administration Program, Dr. Robin Erson, if she is with us, to give her opening remarks.
Great. Thank you, Dr. Akins. Good afternoon and welcome to the USF School of Public Affairs. Thank you for taking time to join us this evening as we celebrate our alumni, students, and leaders in public service. This event would not be possible without our valued partnership with the Suncoast Chapter of the American Society for Public Administration. I've been a faculty member at USF for 18 years and joined the School of Public Affairs in 2013. It was a privilege to be appointed school director in May 2020 and have enjoyed working with both our MPA and our MURP advisory councils to achieve our vision to become a premier community-centered hub for public affairs education and research. At this time, I wish to thank Dr. Akins for his leadership as MPA Program Director, along with our outstanding MPA faculty who organized tonight's event, Dr. John Daly, Dr. Stephen Neely, Dr. Krista Remington, and Dr. Steve Spina. I also want to thank our academic program specialist, Ms. Annie Valdez, our fiscal and business analyst, Ms. Iris Lage, and our graduate assistant, Ms. Kayla Duckworth. I could not ask for a better team of people to carry forth the mission of the school through quality education, research, and service to prepare future leaders in public administration and nonprofit management. Their record of scholarship and community engagement continue to make significant and impactful contributions locally, nationally, and globally. Finally, I want to acknowledge and thank our incredibly talented MPA adjuncts who bring their knowledge and professional experience into our classrooms each semester. Because of all of you, we are serving our communities through strong leadership. This evening is a celebration. Although we cannot be together in person, we can be together in spirit. Tonight's program promises to engage us, acknowledge our successes, honor our profession, and allow us the opportunity to network. So again, thank you for joining us and enjoy the event.
Thank you, Dr. Essen. I would also like to recognize the MPA faculty. We begin with Dr. Daly, who is our longest serving member of the MPA program and our expert in the area of human resources, strategic planning, and labor relations. And Dr. Stephen Neely, our expert in quantitative analysis, policy design and implementation, as well as survey methodology. Dr. Krista Remington, expert in nonprofit management and emergency management, and Dr. Steve Spina, expert in American government and local government. Now I call upon our Braithwaite, the city manager for the city of Oldsmar and the immediate past president of the Suncoast Chapter of the American Society for Public Administration, to give his opening remarks, after which he will introduce our guest speaker for tonight.
Thank you, Dr. Akins. Welcome to all. Thanks for choosing to attend. Believe it or not, most of you are going to have your professional lives and options changed in the next 2 hours. I'm going to tell you why. In this line of work, experience means everything. There's an old saying I like to use, originally credited to Dr. Kerr L. White, that states, "Good judgment comes from experience. Experience comes from bad judgment." For those of you striving to start a career in public service, consider that heavily. Everyone makes mistakes, but your ability to grow and thrive in this line of work is about what you learn from them. Tonight, you're going to learn from the best group of experienced administrators you will ever find in one place at the same time. I tell my staff this over and over again. When you encounter someone professionally that has a great deal to offer, translation, smart, hang on to them for dear life. Develop a relationship with them, go back to them, use them, ask them stuff. On top of the fact that this panel group is brilliant, they're also actually nice people. Use that to your advantage. Your attendance today has provided the opportunity to do just that. The USF MPA program, along with the Suncoast Chapter of ASPA, have compiled a fantastic group of administrators whose experience covers every spectrum of public service possible. They possess countless years of experience. They are present agency leaders, and they also represent the future of the profession, which you find is in quite good hands, thanks to Emily, Katie, and Derek. The experience of this group includes, but is not limited to, fields of nonprofits, paramilitary organizations, military organizations, cities, counties, public education, the state cabinet, and constitutional offices. Here's my advice to you. We will generate questions for the panel to try and get the conversation started. Feel free to ask your own. Listen to the answers. This group is going to share their experience in the most uncharted territory that any of us have ever faced professionally. And you're talking to the administrators who've been at the forefront of their respective agencies before this ever happened and throughout the worst of it. There are many lessons to be learned from that experience. Take notes, write stuff down, establish contacts with all of these experienced public servant all-stars. You won't regret it, and you will remember it. Remember what you hear tonight, not just because you will need to use it if we ever have another pandemic, God forbid, but to help you absorb how these leaders approach difficult decisions. That knowledge will serve you well. I promise that you will use it in some context during your career, and that is how your life will change tonight. I'm very excited to get us started by introducing our guest speaker, who's kind of a mentor and a friend, and I love her. Her name is Jill Silverboard. Jill has more than 33 years experience in local government administration. She is an International City Management Association credentialed manager, a past president of the Florida City and County Management Association, also known as FCCMA, and a member of the American Institute of Certified Planners. Silverboard joined Pinellas County, Florida, as the Deputy County Administrator, Chief of Staff in May of 2019. Her current departmental assignments are Utilities, Public Works, Parks and Conservation, Solid Waste, Office of Asset Management, and Sustainability and Resiliency. During the recent COVID-19 response, she oversaw communications, purchasing, and economic development in support of the Safer at Home orders, facility closures and reopening plans, as well as the purchase of emergency and personal protective equipment. As Chief of Staff, Jill also participates in strategic initiatives and special projects, such as the countywide housing strategy and the Penny 4 economic development and housing programs. Before joining Pinellas County, Jill served as the Deputy City Manager for Clearwater, Florida from 2007 to 2019, where she was responsible for strategic planning, internal service functions, and oversaw the city's primary operations departments. Prior to joining Clearwater, she served as the city manager in both Madeira Beach and in Destin, Florida, and she was the deputy city manager in both Destin and Hallandale Beach, Florida. Jill holds a Master of Public Affairs degree from Western Carolina, we'll forgive her, and a Bachelor of Arts from Lenoir-Rhyne University in North Carolina. Ladies and gentlemen, Jill Silverboard. Jill?
Al, thank you so much. Good afternoon, everyone. I'm so honored to join you and share about our experiences in Pinellas County as it has related to navigating the COVID-19 pandemic. I'm given the audience tonight, I know that you are going to hear things that you're already familiar with if you're in the profession. And as Al said, though, I think we've all learned some things, and I hope to be able to share with you tonight some key points about our journey. I think that the critiques of the unique challenges of COVID-19 response are going to be many years in the making. I think we can all agree we look forward to the day we can talk about this in the rearview mirror as opposed to where we are today, which is continuing to navigate this situation. If Annie could bring up my slides, I'll get underway. Thank you, Annie. If we can go to the next slide. So I want to just briefly say that I believe overwhelmingly that the pandemic response has been local. Our experience in local government and our partners in the business community, the academic community, the nonprofit communities has really ensured that we have done the best job we could to provide services throughout this pandemic. As my colleagues all know, there's no guidebook. There was no guidebook, and there was a great deal of inconsistency from state to state, from county to county, from community to community. And we really worked hard here in Pinellas County with our 24 cities to try to resist some of that inconsistency. And we also worked with our Tampa Bay area partners, particularly Hillsborough County, City of Tampa, Pasco County, trying to make sure that we were hopefully providing some consistency in a situation where we were providing services with very little direction as it related to the community health pandemic response. We in Pinellas County really early on distinguished between our normal work and our COVID work. We really didn't stop doing very much at all during the pandemic. as again, you all know, we still had to treat water and wastewater, and we had to cut grass, and we had to issue building permits, and we still had a number of services that we had to continue to provide. So in most instances, our COVID work was actually on top of our normal work. Now, there were a few things that we did postpone or basically not do. A great example is Pinellas County was heading on a fast track to a referendum on November 2020 ballot for a transportation surtax. The Board of County Commissioners decided really quickly back in May last year, no, this is not the time to propose a tax referendum in the middle of a pandemic. Good call, right? So it's an example, but again, we really were trying to distinguish between and still cover all the normal stuff and all the new stuff that came with COVID. Next slide, please. So our strategy, we broke into 3 pillars. We basically had this enormous category of serving our community and how we were going to be able to address the community health issues and equity issues, all of the facets that were the COVID work as it related to serving our community. Communications, and even though that was really a subset of serving the community, there was so much work and so many efforts and campaigns that were involved in this particular strategy that we made it its own pillar because it really has been a really long haul and a lot of heavy lifting. And then our third pillar was serving our employees. So Pinellas County has over 5,200 employees across all the constitutionals and the Board of County Commissioners. So we have all of them and their dependents that we needed to try and take care of during this pandemic and how we have navigated it and keeping them safe as well. You know, they're our greatest resource. Next slide, please. So beginning with sort of serving the community, we all can remember Safer at Home and other regulatory orders. You know, all of those products took hours and hours of work to prepare. Pinellas County remains under an emergency declaration even now. Now, part of that's related to financial reimbursement and federal programs related to the pandemic, but some of it is also tied to our mask ordinance. We do have a mandatory mask ordinance for public common spaces that continues to be pretty controversial in our community. Second bullet, as you know, as described, we stood up COVID testing sites. We conducted mass distributions. We're now very much operationalizing vaccinations in our community. And again, this is where partners were just so tremendously helpful to us in making sure that our service to the community covered the right kinds of things in addressing COVID. We successfully administered and distributed over $170 million in CARES Act funds before the end of the calendar year. Our program started in May of 2020, and we wrapped everything up before the end of December of 2020. So we're really proud of that work. We believe we got to the right recipients, and those included individuals and families and businesses and nonprofits that were really helping us respond to the pandemic. And I wanted to especially note relative to this last bullet. So here in Florida, as everybody knows, we've got some pretty strict rules about public meetings and public records. And the pandemic created an opportunity where we actually could conduct business virtually. And that's never been a tool that's been available to us. And so we had to stand up the platforms for doing that and making sure that our public could participate. Next slide, please. So our communication strategies were, as I mentioned earlier, very robust. We continue to issue daily situation reports that are provided and pushed out through multiple outlets. We actually created a brand new website and a data dashboard that was specific to Pinellas County because we wanted our community to be able to have access to the same data that we were using to make our decisions, what was driving our work and how we were going to try to keep communications among our 24 cities here in Pinellas. As I mentioned earlier, we've worked really hard and they've been great partners for us as we've tried to be consistent in messaging and communications with our public and our visitor populations. We've used, I mentioned the Citizen Information Center and of course the PIOs, and they participate in the regional PIO network. So again, striving for consistency and message and making sure that we're working with all the right partners and communicating with them. One of the things that Pinellas County did that may be somewhat unique, I actually don't know, but we created a number of community signage and business toolkits for specific sectors of our community, working through the Convention and Visitors Bureau. For example, we provided these toolkits to hotels, motels, resorts, short-term rentals, businesses that were really struggling through the pandemic, such as restaurants and bars. And this was a product that we actually created and then provided to those community partners and businesses. That was kind of a unique thing that we took on. One of the things that communications in our organization also did was they supported all of our internal work as well. And so one of the things that they did is they produced all of the signage, media, and instructive materials that went out to our employees and to our visitors. So as we started reopening buildings, it was important that we have, the right kinds of instructive signage and so forth. And these next three slides I'm going to move through really quickly, but I want to show you kind of what happened in terms of an evolution of an element of COVID response and how we tried to keep improving upon it. I will tell you that it's the topic we're still continuing to debate, still getting a lot of community pushback on, and it relates to the mask mandate. So if we go to the next slide. So we and I called this, tongue in cheek, never enough signs, but we started out with this sign that you see is the visual, a basic bilingual sign everywhere in county facilities, indoors, reminding anyone visiting that's in a common area, which includes, obviously hallways, elevators, reception areas, lobbies, any of those areas require them to have a face covering. So we started out, and this was our sign. Next slide. But then we noticed that people weren't wearing the masks correctly in many instances. So communications developed this sign that's also now everywhere that illustrates how one should correctly wear your face covering. Again, second iteration of, okay, you need to wear a mask. Oh, by the way, please wear it correctly. Next slide. And then these signs, which were developed to try to impress upon our visitors and our clients and customers why we were asking them to wear a mask. And you can see it also incorporated the 6-foot social distancing piece. My point in sharing these with you is that there's a lot of work that went into this, and we have no idea whether this actually helped at all. But the signs are there, and we just continued, as I said, to sort of evolve as we move forward and trying to communicate and get compliance, because our goal was to have people do the right thing and wear masks so that we didn't have to go into an enforcement mode. As I end on this point of masks, as I said, we continue here in Pinellas to have a mandate in public areas, common areas, indoors, only indoors. I expect any day the state will either supersede that, or we're going to reach a point in community vaccination where we're going to be able to hopefully take all these signs down. Next slide, please. And so then we also have the pillar of taking care of our employees and how we were going to continue to do the normal work, the COVID work, and how we were going to deliver services. We did employ remote working wherever possible. About a third of the county employee census actually worked remotely at some point. That percentage is down a little bit now, but we continue to have large numbers of employees that are working remotely. Clearly, there was a pretty significant technological lift there, and our team, I'm just so proud of how quickly they were able to deploy, this particular platform, Teams and Zoom, and whatever we needed in terms of hardware or being able to connect virtually. We did a number of things for our employees that could not work remotely. We had some significant protocols that we employed for a lot of our field operation employees. We put one person in one vehicle, for example. So normally you'd have at least 2, sometimes crews riding 4. We really tried to separate and break those things up and just instill a lot of safety protocols for the employees who could not work remotely. We created a supervisor's toolkit. So as you can imagine, as any employer, and those of you who are with us this afternoon, obviously, I'm sure had to do the same thing. But, you know, our supervisors, managers, and directors had to know how to speak to our employees, whether they've been exposed to COVID or should they go for a test, or, you know, how are we going to handle tracking and those kinds of things. So that was another thing we did. We also, way prior to the federal requirement to do so, we provided our employees 80 hours of COVID leave. Because again, navigating this particular pandemic has been, you know, an individual and a collective story, and we wanted to make sure our employees were supported in ways that allowed them, you know, to continue to do their work without having to worry about time off for either the medical side or some other personal need. We also use a lot of building sanitation measures, same kind of things, you know, hand sanitizers everywhere, UV filters on air handlers. We have a ton of signs that recommend washing your hands, you know, that sort of thing. So we continue to do that. High touch areas are still receiving an hourly for those facilities that are open, an hourly cleaning, restrooms, that sort of thing. So, you know, really trying to make sure that we were serving our employees as well, and making sure that we were able to keep our people safe as well. Next slide, please. So even though it's not over, we have been tracking to the extent that we can what works and what doesn't as we continue to respond to the pandemic in new and evolving ways. We've made a lot of adjustments and modifications along the way. And I liked what Al said in the beginning is, you know, you're going to make mistakes. And that is so true, particularly when you are dealing with something that is so unprecedented. So just in closing, I want to share a couple, 3, 4 takeaways that I have here that I think are going to be important for us to talk about when we get to that rearview mirror, or perhaps even sooner. Our government at all levels, I believe, needs to invest in technology. They need to keep it current. They need to address security concerns, and they need to be ready to deploy. The most glaring gap that I can share with you tonight that we experienced is that the Florida Department of Health does not have a consistent platform across the state for its counties. So each county may or may not have some system. This became hugely apparent to us and critical for us when we started to discuss having appointments for vaccine. There was no system statewide to be able to do that. That's a hard lesson to learn. And in Pinellas County's case, we just went out and bought a software and subscribed to a system and stood it up ourselves. You know, again, not necessarily consistent from county to county, though, and you see that play out every night on the news. So that's an area, though, that I think particularly, you know, local, state, and federal levels, we need to invest in technologies. We also, I believe, are going to have to retool how we respond. So we're really good at short-term natural disasters and man-made, you know, disasters, especially at the state level here in Florida. You know, we're really good at hurricanes, for example, but they have discrete beginnings, ends, and you know, and other than the FEMA reimbursements taking forever, you know, generally in a pretty tight time frame. The other thing about emergency response, that even though we have provisions in our plans for pandemics, they weren't particularly well thought out as the living through it experience is now teaching us. And they certainly didn't provide for that consistency that I've mentioned multiple times, because that has really been our Achilles heel, in my opinion, is that things have been so fragmented. It really has just been a tough road to navigate in terms of delivering services. But we need to retool that. I think we need to think about that because clearly this pandemic not only affected our county, every state, every country. We've never seen anything of this magnitude in our careers. So need to think about that. We also have never experienced anything of this duration. So we're really good at those short-term emergency operations. But right now, the fatigue and, you know, I think we see it everywhere is really something we need to talk about after we hopefully get through this. I also, you know, talked a little bit about our employee well-being and what that has looked like during the pandemic, but I believe there's also a real opportunity to revisit how we create expectations of our employees and how we are going to look like as an employer in the future as it relates to support systems and being able to make sure it's not just our employee, but it's everybody that they have to take care of as well. So an opportunity there, takeaway that I think we need to do. The last one is kind of a maybe a food for thought element. And I have mentioned again this inconsistency issue that I personally have found to be one of the greatest challenges of addressing the pandemic in Pinellas County has been that we worked really hard. You know, we talked to the city of Tampa, we talked to Hillsborough County, talked to our 24 cities, trying to make sure that things weren't different between a restaurant in St. Petersburg and a restaurant in Clearwater. And what we saw, particularly early on, is that not making decisions is making decisions. And it really forced us at the local level to create the response. And I think we've done a really amazing job. So many of my peers and colleagues and the partners that we have in academia and nonprofits and in the business community really helped us respond. And that's why I started by saying, I think the COVID response has truly been local. We appreciate the federal funding. We're going to get more. That's good. That helps. But again, the way in which that is deployed and benefits our communities is local. So, you know, a lot more work to be done. I don't think that the policy discussions, you know, are again going to be long in coming, but I think they're going to continue for, you know, well into the future. And this will be one of those public policy conversations that I think students and professors and practitioners are all going to be talking about for a long time. So those were things I wanted to share with you, and I'm looking forward to the panel. Thank you again. Very honored to be able to speak to you tonight, and I just want to say thanks.
Thank you very much, Jill, for that wonderful presentation. And I'm sure our audience would like to hear some more. So we'll move on to the panel discussion. And at this point, I would like to call upon Dr. Steve Spina to introduce our panelists and moderate the panel discussion. Dr. Spina.
Thank you, Dr. Akins. Good evening, everyone. Before I introduce our panelists, I have a brief announcement. Guests on the call are invited to submit their questions throughout the panel discussion in Teams chat. So if you have some questions you want to ask, you can do it throughout the process. Annie and Kayla will get to them at the end during the question and answer segment. So thank you very much. Now I'm going to introduce our panelists in alphabetical order. Our first panelist is Chief Derek Brewer with the City of Zephyrhills. He started his law enforcement career in 2002 as a patrol officer with the Zephyrhills Police Department. He has advanced through the ranks, serving as a field training officer, sergeant, lieutenant, and captain. He was named Chief of Police in September 2017, following a 4-month tenure as the department's interim Chief of Police. Chief Brewer holds a Bachelor of Arts degree in Criminal Justice from St. Leo University and is a graduate of the St. Leo University Command Officer Management Program. He is scheduled to graduate in May with a Master's in Criminal Justice Administration degree from the University of South Florida. So welcome. Our next panelist is Kurt Browning. Kurt Browning was elected Pasco County Superintendent of Schools in November 2012 and was reelected in November 2016 and November 2020. Prior to that, Superintendent Browning served as Florida Secretary of State under both Governor Rick Scott and Governor Charlie Crist. Browning spent 27 years serving as Pasco County Supervisor of Elections before his appointment as Secretary of State. Superintendent Browning is a certified superintendent of schools. He is actively involved with the Florida Association of District School Superintendents, currently serving as immediate past president, and has completed the Chief Executive Officer's Leadership Development Program through the Florida Association of District School Superintendents and the Florida Department of Education. He also is a member of the 2017 class of Leadership Florida Education. Superintendent Browning is a native Floridian. He earned his associate's degree from Pasco Hernando Community College and received a bachelor degree in political science and a master's degree in public administration from the University of South Florida. Our next panelist is Emily Colon. Long fascinated by human behaviors and investigative analysis, Emily originally thought she'd someday be an FBI agent. Upon evaluating whether she was suited for a career of physical danger, she changed gears and retrofitted her talents to be a different kind of public servant. As a broadly skilled creative professional, Emily is the assistant city manager for the city of Lakeland. Prior to the city of Lakeland, Emily served Pasco County at the state level as a gubernatorial fellow and at the federal level with the U.S. Senator. Emily is a problem solver and works to build strong, productive relationships to achieve the goals of the community she serves. Originally from Minnesota, she came to Florida as a collegiate volleyball player and first-generation college student to Manatee Community College. Additional degrees earned from the University of South Florida in international business and her public administration degree have honed her clear and concise communication and project management skills. In addition, she holds her certified public manager designation from Florida State University and is a former Sterling examiner. Emily is active in several industry and professional associations, such as the American Society of Public Administration, engaging local government leaders, the Florida City County Management Association, the International City County Management Association, and Leadership Florida. Additionally, Emily serves as an adjunct professor for USF School of Public Affairs. Emily and her husband, Rick, are the parents of 2 young daughters. Bill Horne was appointed by the City Council to serve as the Chief Administrative Officer of the City of Clearwater with responsibility for all departments except City Attorney's Office. He is one of only 2 employees who report directly to the Council. He is directly responsible for 1,837 employees and accountable for the annual operating and capital budget of $539 million. With a wealth of management experience in dynamic and fast-paced environments, Bill came to Clearwater in 1998 as the General Support Services Administrator. He was selected as interim city manager in 2000 and was appointed to the position of city manager in 2001. Bill has been a credentialed manager since 2005. Prior to that, he served as a colonel in the United States Air Force. Bill earned his Bachelor of Science in Chemistry from the University of Tulsa, a Master's in Human Resources Management from Pepperdine University, and a Master's in Political Science from Auburn University. He has been a member of FCCMA and ICMA since 1999. He is also a member of the National Forum of Black Public Administrators. Katie Parkinson has a master's degree in public administration and a graduate certificate in nonprofit management from the University of South Florida. Katie has been working in the Aging 8 Network since 2000 with significant experience helping to administer in-home service for vulnerable older adults with an emphasis on Medicare waiver programs. Her primary responsibilities as a Chief Operating Officer at Senior Connection Center, Inc. include working to ensure that program services continue to be available to those most in need and that those services are of the highest quality to the state. Katie serves on the USF Public Administration Program Advisory Committee and the Tampa Hillsborough Homeless Initiative Point in Time Committee. She also is the proud recipient of the inaugural Joan Ellen Pynes Excellent in Nonprofit Leadership and Management Public Service Award. So those are our candidates. And I lost my questions. Oh, here they are. Okay. So now I'll begin the question portion. Mr. Horne, I'm going to start with you. I'm going to ask everybody the first question. In your professional capacity as a city or county or nonprofit official, what was the biggest surprise you encountered because of the pandemic?
Thank you, Dr. Spina, and I'd like to say hello to everyone who is with us this afternoon. I was thinking about everybody on this panel and many that I have met in the past, and I'm reminded of a statement that someone told me: the main thing should always be the main thing. And I'm a city manager, and my job is municipal service delivery 24/7. The biggest surprise that I experienced was the extent to which I had to be directly involved in establishing administrative policy where none existed previously that all employees had to adhere to. As Jill mentioned earlier, there was no script. How many pandemics have we experienced? And because of that, the only thing that we had to relate to were major hurricanes. We all are experienced with major hurricanes, and so I won't say that we could do it in our sleep, but I would say that generally speaking, we're very familiar with that kind of disaster. And in that situation, some citizens are impacted more than others. What we experience is that the pandemic makes everyone vulnerable, regardless of their status in life. And the municipal employees really showed their vulnerability to the threat of COVID-19 infection and the corresponding fears associated with it. It was clear to me that I had to have the 1,837 employees that I lead every day completely behind me. For them, the pandemic was viewed as a life and death affair, and yet they were responsible for municipal service delivery 24/7. Half of the workforce are essential employees. They clearly were going to be in place doing the kinds of work that keeps a city operating. The other half were not as essential, and so it's certainly during the shutdown, most of them were either operating from home or were just simply at home because there was no reason for them to be in their normal work centers because we were trying to not contribute to community spread. But I must tell you that the biggest surprise was that I had to be in place and working with our HR director, creating policy to make sure that all of the employees understood what was expected of them. And then where we had no policy, we had to create policy to ensure that we kept things moving.
Thank you very much. Ms. Parkinson, I'd like to ask you, in your capacity as a nonprofit official, what was the biggest surprise you encountered because of the pandemic?
So thank you, Dr. Spina. As you introduced, I represent the Senior Connection Center, and we happen to be the one lone nonprofit entity on this panel. So just before I kind of launch into my biggest surprise, I like to share a little bit about what our agency does, because not a lot of people are familiar with it. So like I said, we're not a city or county governmental organization, but we do operate as a quasi-governmental organization. As a 501c3, we do run the local area agency on aging and aging and disability center. And we're one of over 600 area agencies on aging across the country that create an aging network and a support system for our seniors. So we serve our community. We have a 5-county community that we cover, and we contract out annually between $25 and $30 million. And Hillsborough County, where I'm located physically right now, is one of those counties that we serve. We actually fund Hillsborough County Board of County Commissioners, Department of Aging Services, which is unusual. Usually it's the county government doing the funding for services. So it puts us in a little bit of an unusual position there. And we work in concert with them to make sure the services that are needed throughout the community get to those seniors. Because of the bulk of that funding is coming from the state and the federal government, there's a lot of strong contractual requirements that go with it. And that creates a lot of friction when you're talking about needing to move quickly, get people served in this really confusing environment that we are dealing with. And so I thought my biggest surprise that I found as we were trying to really serve these most vulnerable, our senior population, those most vulnerable out there with those services that they need. We're talking critical services like meals, the home delivered meals, the Meals on Wheels program that most people have all heard of, homemaking, personal care, respite for caregivers, daycare that wasn't going to be able to be provided. So what was going to happen to those folks when their family members that were like dropping them off at daycare every day, needing to go to work because they had essential jobs. Now, who was going to help take care of that loved one? We help provide and fund those legal assistance, housing improvement, caregiver training and education. So we really had to look to see how we were going to continue to serve this population during this period of time, especially when the population that we serve, our typical clients are in their 80s and they're very frail. So we had to look and say, we've got to be able to move quickly. And my biggest surprise was the government actually recognized that, the need to be flexible. And they really looked at creating policy and working in a very responsive way to make sure that, if we had to figure it out on the fly, we figured it out on the fly, and we worked together on that. And so that was really wonderful to see, because we're all kind of in this endurance race right now. But I think I've heard many times it's like running a marathon, just keep going and going. So although it's been challenging, I think everyone really started off being so focused, from the state actors on down the line to our vendors, to figure out what we needed to do and then pivot to doing that. So it was very impressive.
Thank you very much. Ms. Silverboard, as a county administrator, what was the biggest surprise you encountered? I know you've gone into it quite a bit, but.
Yeah, thank you, Dr. Spina. I'll be really brief because I really kind of talked about this in my my presentation. I think it's just been the lack of guidance and how decentralized the response ended up being. I can't get my brain around that because I think, generally speaking, we've got great systems and great relationships, and I'm still perplexed by that. And so I think it was just that there was no guidebook. And again, we were making decisions at really, really sort of micro level that I think, we ended up having to unwind some of those as guidance began to come out from the state. And anyway, that was my biggest surprise. Still surprised by it. And, maybe I'll learn something tonight. It'll help me feel better about that.
Okay, thank you very much. Chief Brewer, I'd like to ask you, in your capacity as a police chief, what was the biggest surprise you encountered due to the pandemic?
Well, again, thank you for having me. I appreciate it. I wanted to shout out to cohort 15. Go Bulls. We're almost there. But I'd say the biggest surprise during the pandemic for us was just the constant adjustments that occurred almost daily, and how much it affected our everyday operations, how we took complaints, how we managed our staff, how we handled exposures. It was just constantly evolving. And as it's been said many times, there was no playbook. So we were learning on the fly, and we were really figuring it out as this thing played out before us.
Okay, thank you. Thank you very much. Superintendent Browning, in your capacity as school superintendent, what was the biggest surprise you encountered?
Thank you, Steve. I'd like to think that nothing surprises me anymore, but I will tell you that I can remember it was a year ago that we got the call that want to know if we were going to be on spring break, and we said we're going out next week, and they said, well, guess what? You're going to take 2 weeks, and then when you get back, you're not coming back. And by the way, you need to have a distance learning platform ready. And I think Bill said it earlier. I think it was the whole idea of having to do things so quickly. And in Pasco, of what I would call the 3 counties, Hillsborough, Pinellas, Pasco, we're the smallest. We have about 80,000 kids, 90,000 schools, 90 schools, 12,000 employees, and everything just converges so quickly. And you have got to remain sane enough to make logical, smart decisions. And the fact of the matter is, nothing is logical in this. It really isn't logical. I guess the other surprise, the surprise that I had was, and this is, and I still I'm surprised, is how political the virus is. And when you're dealing with families, as we do all across the spectrum, just the simple thing as wearing a mask and how political that's become. And that's the reason we've anchored a lot of our decision making in CDC requirements. And I know that, you know, our county commission has made rules. I know our school board has made rules, but we are really following the CDC recommendations on a lot of things. And parents don't understand that, particularly when you have states like Texas that are saying, you know, we're opening up, everything's good. It's almost like the virus is gone now because, you know, a few people have gotten the vaccine. And I will tell you, I've always erred on the side of caution, and I'm a pretty conservative guy. And we just want our kids safe. We want our teachers safe. We want our staff safe. But it is every time you peel back a layer of the onion, something else came up, and it continues to surprise me even after having been in this a year.
Yeah. You were in a unique situation, Shirley. Thank you very much. Ms. Cologne, as assistant city manager in Lakeland, what was the biggest surprise you encountered?
So I think I could say ditto to everyone.
Yes.
Because, you know, even though we are all experiencing at the same time, it's kind of like we are living parallel lives, right, in our respective roles. I will say one thing just to add something different is when we talked about communication and it being different than a hurricane and how we kind of all knew the playbook. Well, when I would stress the need to over communicate, I would say, think about when a hurricane comes, right? And we play this crazy game of telephone and I tell you and you tell the next person. Well, when it gets to the third person has lived through a hurricane, so they know better and the message gets cleaned up every time so it doesn't get as distorted. But with COVID-19, that message was distorted the minute it left my mouth because nobody understood it. So I think just the idea that we just can't communicate enough, and I think of myself as someone who's highly communicative, and even then I was like, there's not enough hours in the day to get enough words out. Like I'm constantly sending messages, meeting with our employees, making sure they're secure, you know, our commission, our stakeholders in the community. It was just, it felt like a communication overload for me, but for them, they were hearing it the first time or being explained. And like Kurt said, just really grounding ourselves away from the politics, because locally, you know, something at least that I love locally is that we're nonpartisan. We really don't have that red and blue divide that we see nationally. Locally, you know, we still keep it pretty peaceful. So I think this definitely challenged us locally, politically, and just being able to root ourselves in the CDC, and we also partner with our Department of Health. So those were our two constants because we're not medical experts, right? So we had to lean on the medical experts instead of just bringing anyone in. So those were my big takeaways to add something new.
Good. Thank you very much. Mr. Horne, the pandemic exposed the fact that most government workers are basically termed essential and have to remain on the job. How did this crisis result in your reframing how you operate, and what innovations helped you keep your doors open and your employees in the field?
The fundamental principle that I had to employ, at least from my perspective, was a total commitment to keep essential services up and running. You know, that was the priority. But what's interesting is that I had to focus on city employees. I had to focus on council members to a certain extent. I had to focus on citizens and residents. I had to focus on county emergency management. And all of this, I had to do simultaneously. So as a result of that, I had to create a framework that allowed me to manage all of this on a day-to-day basis. So basically, I created a standard 9 a.m. meeting with selected staff participation that consisted of the city attorney, the emergency manager, assistant city managers. I had two of them, HR director, public communications, and the police chief. And so in March, we essentially met every day. And then as the pandemic wore on, as things settled down, we then transitioned to a 3-day-a-week meeting. And right now we are doing a 1-day-a-week meeting. And that allowed us to kind of keep our hands on everything, and allowed us to react to not only pandemic-related business, but non-pandemic related business, because again, the life of a city, it involves a lot of things that are not necessarily related to each other, but yet it's a city responsibility. So that was kind of how we approached that.
Good, good, interesting. Thank you very much. Ms. Parkinson, you had mentioned that you were serving a frail community, elderly and frail community. So many of your staff are also essential. How did you reframe how you operated? You talked about not being able to drop adults off at your adult daycares. What kind of changes did you have to face?
Yes, so thank you. I saw in the chat someone asking about the pandemic playbook, like why didn't we have one? We have a very robust disaster plan and continuing operations plan, as I'm sure all of the entities on this panel do as well. And it covers pandemics, but it covers them from a very local, regional level, not something that is across the entire country. So there really wasn't, I guess that was where people got blindsided, and being able to be as prepared for something like this as we could have been. So we had our disaster plan. We went to it and looked at it. Again, we were dealing with unprecedented situation and understanding that we are an essential workplace. We need to function to make sure that we can get that critical help to those seniors in their homes that need it and their caregivers. So when it came down to it, we looked at our org chart and we had to determine, what staff can work from the office, what staff are going to be able to work from home. The majority of our staff are working from home remotely. We were able to, set them up with the equipment that they needed to do that pretty much on a full-time basis. I personally like to come into the office, and we keep a skeletal crew here. So we've got administration in the office, and we are open to the public. So as long as they're following safety protocols, we can have interaction with them, and we always have staff on site to be able to assist them with the problem they might be having. But like as Bill was saying, having that thoughtful communication and engagement was really critical. And we talked at the very beginning, as we were getting ready a year ago to start sending staff home to work full time, how are we going to do that? And so we thought about our engagement plan and our communication flow. And it is so funny that Emily said the telephone game, because that was actually referenced yesterday twice in my office. Like, how did this get said this way? I'm not quite sure what's happening here. So it's really funny that you use that phrase. But our president looked, like that engagement, stomping out siloing that might start to pop up, being, aware of it and tuned to it. And then our president and CEO required all of the managers that oversee staff to have an engagement plan. So we had a very formal engagement plan. And I thought it was also funny how Bill was saying at first it was like very frequent contacts, and they've gotten lesser. I'm down to once a week with my direct staff having that formal meeting. As opposed to having those meetings every other day. I think we're probably all kind of zoomed out at this point. We're more engaged than I think we might ever have been at this point, with our staff and folks around. So, but she also implemented a Friday message. And so she crafts that herself, and she shares that directly from her. It's a very personal message. She talks about what's going on with her and her life, how she's coping with things. She'll share something funny or touching, videos, things like that. We've instituted a book club for folks that are interested. We've done cooking classes, so things after hours that can be done together collaboratively for folks that might want to do that. We've done surveying of our staff to ask them how the remote work is going, if they have the resources they need, do we need to make any improvements? Overwhelmingly, staff have been very positive about the change, and most want to continue to work on an at least part-time remote basis. We've been able to continue operations and getting services to people. It has had to change, like you said, the daycares have closed, so we had to shift to doing services in homes. And, so that can be more challenging, oftentimes, not ideal. But just having those schedules, that structure for people that need it and want it, and then making sure our office is open to our public so we can keep things operating. And so far, it's been working. Engagement and communication is key.
Good. Thank you very much. Very interesting. The Silverboard, you already explained some of the things you all did in Pinellas County that were different, but were there any kind of innovative changes that you made, maybe to a service that you provide, that, or some other change that you had to make that you could talk about for a minute?
Sorry, I was muted. So yes, I shared some of this, but couple points I want to share about. Our biggest concern were areas of our operations that had a built environment that did not allow the social distancing. Okay, so 911 center, right? You can't just pick it all up and move it somewhere else so people can be 6 feet apart. It just, our traffic comm center, they weren't physically built to allow for some of the social distancing. We had to get pretty creative for a couple of those areas. Also at the jail. I mean, we were really worried about, one case in the jail, and then, we're going to have, everything's going to be out of control. So we actually had like 18 working groups that were created to address different issues related. We had a working group on this, and we actually, again, had to use some technology and get creative about how we could, separate people. And those became our priorities for PPE and being able to use things that could protect individuals. And so that was a pretty specific strategy for those areas. One thing that I really want to mention that we're talking about a lot in Pinellas County, it's kind of more of a future looking thing, is that talking about those built environments. So we go to the Emergency Operations Center, and it's the same thing. It's desk after desk after desk. So it wasn't built to operate during this type of an emergency. So we also are doing a space study. So we're really looking at how is remote working going to impact what we need in terms of office space in the future? How are we going to conduct business differently? So the working group that we created earlier in the pandemic for keeping people safe is going to continue to be working on those issues. Because we don't think we're going to need as much physical space, and we don't think that we're going to be creating situations in the future or building anything that doesn't take a pandemic into consideration. Right,
very interesting. Yeah, a good look at how the different types of emergencies differ, and how you have to set up for them differently. Thank you very much. Chief Brewer, I'm going to deviate from this question for a minute and ask you, how have police, and kind of included in this question, but I understand that you're focused on police, deputies or paramedics, handle contact with the public in face of.
I'll be done soon.
Did that come through?
I got it.
Okay.
Yep. So it's been an adjustment. For sure. Officers are typically creatures of habit. So we did have a little silent resistance to the change. But I would say most complied and handled it just like they did any other crisis. That's what I've always admired about public safety personnel, is they adapted, they buckled down, and they got it done. And they've continued to do it.
Do they wear masks and gloves and that kind of contact in the public all the time, or?
We still have to reinforce that, but at the same time, we have seen that they have they're trying to protect themselves, protect their family, and their coworkers. So they've done a very good job. We all have been in a situation where we may have forgot our mask or whatever, but they do a good job of making sure that they have that stuff with them when it comes down to protecting themselves and the public.
Okay, thank you very much. Superintendent Browning, I'm going to go back to the question about maybe reframing how you operate and what innovations helped you keep the doors open, because you had to shut down, as you mentioned in the last question, and then you've reopened. So how have you had to look at doing things so differently in the school district?
Yeah, we had to reopen very quickly, and our teachers are not accustomed, in large part, to teaching virtually. They're used to going to a school, going into their classroom, and having students sitting there in front of them. And the last quarter of last year, I jokingly say, I mean, their hair was on fire because we were telling them that they were all going to have to be teaching virtually. And I will tell you, to our teachers' credit, they rose to the occasion. We trained the 5,700 instructional staff that we had in about 4 or 5 hours. And you could see the just smoldering smoke at that point. There was no flame. It was kind of nice. And then they started teaching virtually. And it was a challenge. It was a challenge both on the part of the teacher, and it was a challenge on the part of the student. And I have to include parents in that because parents ended up being the pseudo teachers, the pseudo managers of those kids while they were home. I mean, I think I heard from every parent that there was, and we had to do something differently when we got back into school in August. And we did. We surveyed parents. We listened to parents. We listened to employees. What would you have different? And what they were looking for was structure. And so we created what we call My School Online, but it was a structured environment. So, for example, if you had Algebra 1 at the high school at 7:30 in the morning, Monday through Friday, and you were going to do it virtually, unlike the fourth quarter virtual model, the new school year model was that you would be doing Algebra 1 at 7:30 in the morning, Monday through Friday. It was going to be on a computer, and parents appreciated that. We heard from parents, but I will tell you, it was the way we had to feed kids. I mean, we served over 1 million plus meals to kids from March to the school start in August. 1 million meals. I mean, wow. My cafeteria, my food nutrition services folks, I mean, they weren't accustomed to doing that. They were accustomed to putting food on a plate and having kids go through a line, and that model was gone. Mm-hmm. And so we just had to be innovative, but we had to do it all very quickly. We had to do it efficiently. And at the same time, we're having to deal with folks out there that didn't think COVID was real, didn't understand why we weren't in school. Today we've got about 75% of our kids back in bricks and mortar. 25% are still staying home, but I think that's going to change when we get back into school in August.
Right. Thank you. That's very interesting. Thanks.
We have time for 2 more questions, and then we'll move on to questions and answers. So, Dr. Spina, if you want to ask those that haven't had the opportunity to, provide answers to the second question, then we'll move on.
Okay. Ms. Cologne, I'll ask you this question. What kind of reframing did you do in Lakeland to how you operate, and what innovations helped you keep things operating?
So in the city of Lakeland, we have 2,600 employees, to give you an idea of the scope, and 4 very active unions. So we needed to make sure that what's fair isn't always equal. Especially with the safer at home, where you have field workers who, when you have police and fire, well, police and fire can't go safer at home, right? So they are still working, but you have an accounting clerk that can go safer at home and do remote work. But there were some people who went home, like Bill had mentioned, who were just at home, right? But then when we came back, it was re-implementing our workforce. That was, we got I need pandemic pay, and we would still be getting pandemic pay, right? And we can't afford that with the hits that we took. So we just had to get creative again with the messaging. Some of the things that we served our citizens and changed. When we reopened as a community, we had to relax our sign ordinance, for example, because, restaurants needed to do takeout, or yes, that they're open. So that was a way that we could partner with the community easily to just say, hey, chill out, code enforcement. We're going to kind of waive the sign ordinance right now. And we saw signs on bed. It was tacky and it was awful, but it helped show our partnership with our community, our local small business, and in the city of Lakeland, we love our small business. So it was a way that we could kind of say, hey, you're not alone. So that was something that, we would never think that we would endorse as a city, but we certainly did. Going to virtual inspections, which I'm sure were pushed in other communities as well. Another thing was outdoor seating. Normally they're permitted. We opened it up in our downtown core. Just little, I say innovative ideas, right? When you say them, you're like, they just kind of sound a little bit common sense. But for us, we weren't there pre-pandemic. So I think if I'm going to say something positive at the pandemic, it really showed us how resilient and how adaptable we really can be at the local level, and how we can partner with our local economy. So
good. I think that we'd all agree that common sense could be innovation in government sometimes. So thank you very much. Dr. Akins, everyone's answered 2 questions. Do you want me to?
Okay. Thank you. I want you to ask Kurt Browning the question on education with regard to the students from disadvantaged background.
All right. Kurt, we have one last question for you. How have school closings affected student performance, especially students from low-income communities who may have struggled to access technology at home? And what assistance is offered to improve learning outcomes?
To say that COVID had a dramatic impact on student performance would be an understatement. It has put school districts, and not just Pasco, but school districts across Florida. It has put our students, although we have been in school in August, and I kind of chuckle when I watch the evening news and you hear about states struggling with opening schools, and I'm thinking, well, we've been doing this since August. But we've done it very well. I will tell you, we've done it very well. That being said, we have folks. I testified for the Senate Ed Approach Committee back in January, and one of the points we wanted to get across to them is that yes, after everyone gets the vaccine and we get rid of these things and we quit wearing them and we can get back to normal, this pandemic, or the impacts of this pandemic, are going to be with us academically for years to come. We've got kids that because of a choice their parents have made, have put them in a virtual learning environment. And I'm talking about this school year. Everybody was virtual last quarter, but we're talking about this school year. We've still got about 25% of our kids virtually. When we got back from Christmas break, we started calling families of kids that data showed that they were not being successful. And we said, your child needs to be back in a bricks and mortar classroom before a great teacher. And the parent says, no, I'm going to keep them virtually. Do you understand your child's not successful? Yes. They need to be back in a bricks and mortar classroom. No, I'm going to keep them home virtually. So it's a parent choice. But these kids are the ones that are going to be struggling for years to come. And it's just incredibly troubling to me. When you talk about low-income families, we equip school buses, and Pasco's not unlike Pinellas, Hillsborough, Polk, Hernando, name a county that equip school buses with internet and park them out in neighborhoods so they could have Wi-Fi. I can't tell you how many hotspots we bought and we issued to kids so they could do their work. But then we did our part, and what I keep telling our parents is, you've got to do yours. You've got to make sure your kids are signing on, they're doing their work, they're submitting their assignments. And what we're finding is, in large part, is kids that are still virtual are not signing on. They're signing on and just putting their name up there. You don't know if the student's there or not. How do you make a child virtually turn their camera on? You can't. And I will tell you, Parents need to partner with us in order to make sure their kids get their education. I have some grave concerns about where we are academically with our kids moving forward. And then the last comment I'll make, the bigger piece of this is from a job perspective, a job market, even with our third graders, where we find our third graders today, they're going to be in the school system now for another 6-7 years. And so what is that going to have impacts on our job market and our college, the enrollments at our state colleges or our state universities? Some may say I'm being a little overly dramatic about it. I say I've seen the data, and it is frightening. It is frightening. The amount of remediation we're doing with extended school day now, an extended school year, it is, and thankfully we have federal assistance to do that with. We've gotten a significant amount of money of ESSER money or CARES money, and we're still waiting for the second bit, and now this latest amount that's going to be coming down to us, and we're going to be using every bit of it in large part to remediate kids. So pray for the school system, pray for kids. I mean, it's significant. It really is.
Thank you very much.
Thank you. We now move on to the questions and answers. We have a couple of questions that have come in, and we're gonna do our best to answer a few. Unfortunately, we cannot answer all of them. So Annie, what do you have for us?
Yes, so the first question is for Bill Horne, and the question is, how do you think students entering into public service careers need to be prepared to provide services in a post-pandemic world that may differ from generations before?
I think that the more you can do to prepare yourself for what the public administration landscape is going to be like in the public organizations that you may likely be employed in, it's worth your while. One of the things that I like about public administration programs today is that there is a much stronger emphasis from a practitioner point of view, so that once you get through a program, when you show up for that first job, you will have some appreciation, some idea of what's going to be real for you, as a public administrator. So I can't overemphasize that enough.
And our next question is for Emily Colon. What specific criteria will you use to decide when lifting the mask mandate is justified?
So in the city of Lakeland, we were a little bit different. So our city elected officials wanted to be more restrictive than the county officials. So at one point we had anti-masker protesters in City Hall with bullhorns. We had them at commissioners' houses, and it got pretty divisive, as Kurt had alluded to earlier. And we were very torn in our local landscape between county and city. Right now, we don't have a mandate. We have a strong encouragement. However, legally, in all of our city-owned buildings, our city properties, we can mandate the use of masks, facial coverings, and masks. And we do that on the properties that we own. When we will lift it is our commission has set certain parameters of the COVID positive rate. So we have to be below a certain rate for a certain amount of days, and then they lift it, and it becomes strongly encouraged, just a little less strongly encouraged. But right now, it's not a mandate, so that's where they kind of have the flexibility and freedom to ride it out a little bit longer than as opposed to a mandate. But we follow the numbers of the COVID positive rate. Right.
Great. So the next question is for Jill Silverboard. So based on your experience dealing with the pandemic, what kind of guidelines do you think the federal government should include in a pandemic response playbook that states could then turn to if something like this ever happens again?
Well, it's a great question. So I think that some of my earlier points kind of are my answer to the question, because I think generally speaking, our states are, we're pretty decentralized, right, from the feds. And so that's by design. But I think that when you find yourself in a public health crisis that's impacting the entire country, there's got to be some strategy there. And there's got to be some consistency and direct, just because interstate travel and, for all the reasons that we all know. So I think one of the areas that would really be helpful would be to have defined deployment approaches for whatever, let's use COVID, but testing or now vaccines, because every state, every county is even doing vaccinations differently in Florida right now. And it's just all over the place. And so I think there could be some really good work done to help kind of frame, what that would look like. I think the other thing that would really help, again, would be having consistency in directives and orders and, not politicizing them, as, Mr. Browning mentioned, because it's been brutal. But I think there's an opportunity there as well that you could predefine, kind of like what we're using for our criteria for our mask mandate now. You could predetermine sort of what some of these categories and criteria would be. The products that eventually came out of the state, for example, for the different phases, it was good. I mean, it's good work. It was just that we were already, 90 days into the grand experiment. So anyway, I think technology, I would say, is the last thing. I think the federal government could really support a technological platform that, maybe through FEMA, maybe through some other emergency management, because we have a national incident management system that hasn't been used for this pandemic. But perhaps could. And I think the reason it wasn't used is because this is a community health crisis. It is not a natural disaster or some other type of man-made disaster. And I think there's a model there that could probably be replicated in the future and help us all.
If I can jump in and comment, one of the things we need is national leadership. And I think we suffered from that. But Kurt had talked about anchoring his approach in CDC compliance. And I want to go back to that, because that is, if you really want to influence employees to follow you, you've got to use science, because everybody's got an opinion about what they think is real and not real. And I think that sort of approach that he took, which we followed the same sort of path. We have a full-time emergency manager, and his focus was on keeping up with the CDC guidelines and what direction that they felt, based on science, you should go.
And Bill, if I could just jump back in on, to follow up on Emily too, is that our criteria for when we're going to lift the mask mandate, is a product of not only our community health professionals, but the hospital administrators at the Tampa Bay area. We actually formed a group to say, okay, what are going to be the measures that are going to guide us? And it's the same kind of stuff Emily talked about. But again, we're having to create that conversation. So I think you're right. I think you're right, Bill. I think, CDC, I think they tried, but it was all advisory.
And because of time, we're going to ask just one more question, and that's going to be for Chief Brewer. We've also had another major issue occur during the pandemic with regard to police reform. How have you been addressing the community's concerns while taking officer safety into consideration? And have you used representatives from both sides in your problem solving?
Yeah, that's a great question. And I can tell you, we speak about it frequently in law enforcement, about this past year being the perfect storm. Not only were we dealing with the pandemic, but quite a bit of civil unrest. And we've engaged in those conversations, and we've continued to have that dialogue. Now, has the virus slowed down progress? Yeah, I believe so. But we're still having those conversations, even if it's virtually or over the phone, or we're still, law enforcement is not one of those professions, as it was mentioned earlier, that you can be safer at home. So we are still in the public eye. And we're making contact, and we're still making sure that we're taking the steps necessary to gain that trust back from our community.
Emily, you want to add to that so that we wrap up the questions and answers session?
Add to the last question? Sure.
Yeah, just touch on what Chief Brewer discussed.
So, I think Dr. Spina mentioned I'm from right outside of Minneapolis, right? So last summer really hit home for me, watching family members' homes be right there, and businesses right there in Minneapolis where George Floyd was murdered. So to me, it was a very personal issue that I was removed from physically, but then I had it locally, how we were in our strategic planning retreat, and it was kind of one of those defining moments of, are we going to address that, or are we just going to stay silent? And I was really proud of our commissioners for bringing it forward and talking about it. That was just one of the major events. But we really talked about, what was going on nationally and then what we were doing locally, so not encouraging civil unrest locally, but also making sure that the force, checking in with our police chief and just saying, could this happen in Lakeland? And are we doing the proper measurements? And it was a publicly broadcasted meeting, and how are we going to protect us? And, we work really hard on community policing, which of course, a bunch of people do, but it was just reinforcing the strategies that we had already put into place and the community relationships that we had built between our police and the community. And we just kind of bumped that up a notch, even having our police athletically, our PAL for the cheerleading and football, even though they couldn't do that, we still had outreach efforts just to, again, unite us as a community. And then we also did, that spun out of that, our mayor did it's called Lift Lakeland, and it's about becoming a more inclusive community. So I think some really good conversations and some promising, long-lasting action came from that.
Thank you very much to our guest speaker and the panelists. We now move on to the second session. I will now call upon Dr. Stephen Neely to inaugurate our MPA ambassadors and also give the Dean of Ambassadors the opportunity to speak. Dr. Neely.
Thank you, Dr. Akins. I appreciate it. And I'm gonna put my video on here, and we'll see if it holds up, because I've been having some little network warnings flash on the screen. If it gives us problems, I'll turn the video off. I hope everybody's doing well. I appreciate you all taking the time to join us tonight. As all of you know, academic programs like ours are part of a professional community. They're one piece of a professional ecosystem, and the extent to which we can successfully do what we do depends on how well we coordinate and network with the professional community, with those that are in search of more professional training and education, with those who have received it, and with those who are in the process, how well we connect with the field of practice, connect our students with professional opportunities, connect our alumni with one another so that you can continue networking and growing professionally even once you've left our program. That's very important. And so under Dr. Akins' leadership, we have been working to formalize our approach to doing that. And the MPA Ambassadors program is a step forward in that effort, to where we're going to more intentionally formalize how we connect with how we stay connected with our alumni, how we connect with future students, and how we connect with the field of practice. So thank you to Dr. Akins for his leadership in getting this program started, and especially thank you to our first 14 MPA ambassadors, those who have committed their time and expertise to this effort. I'm going to introduce them, and then I'm going to hand it off to our friend Jeff Tillman to talk a little bit further about their efforts and how they're going to be proceeding. But I'd like to just briefly introduce everybody and acknowledge their willingness and their sacrifice in participating in this program. So Elizabeth Cardenas is Hillsborough County's Division Director for Compliance Services. Elizabeth, thank you for participating in this program. Emily Colon, whom you've all heard from today, the Assistant City Manager from Lakeland. Sain Hadara from Timbuktu Association for Community Development and the Sahel founder and president. Zoe Jenkins is Jefferson County, Colorado's Budget Analyst and Local Government Management Fellow. Ryan Levengood is Lake Alfred City Manager. Sean Lopez, City of Largo's Management Analyst for the Office of Performance and Budget. Lisa Mifflin, Office of the Comptroller of Currency, Office of the Comptroller of the Currency's Southern District Community Affairs Officer. Susan Obarski, ISPE's Senior Director for the Project Management Office. Ratna Okai, who is a UCF PhD student in Governance and Policy Research right now. Alexis Searfoss, who is USF St. Pete's Associate Director of Constituent Relations for University Advancement. Okan Suler, who's Turkey's Ministry of Treasury and Finance Treasury Controller. Jeff Tillman, Auburndale's Assistant City Manager. Justin Tramble, from the City of Treasure Island, the Assistant Director for Parks and Recreation. And Liz Wooten-Reschke, who is Connect for More President and CEO. And none of you have short, easy job titles, so thanks a lot for that. I really appreciate it. No, but thank you again so much for your willingness to participate and to continue connecting with the MPA program in this way. I'm going to hand it over to Jeff Tillman to talk a little bit more about the MPA ambassadors and their vision moving forward.
No, thank you, Dr. Neely. I appreciate the introduction, and I'd also like to compliment Dr. Akins and all the MPA staff that have put this event together this evening and putting together all the wonderful speakers. I think we can all take something away from the conversation tonight. But I would like to speak on behalf of the MPA Alumni Ambassadors, and could not be more excited to work with such a great group of individuals, to be able to give back to the program and connect with students and alumni as well. Several months ago, we received an email from Dr. Akins kind of gauging all the alumni's interest in creating this Alumni Ambassadors group, and how we can help serve and help promote the MPA program. And I feel Dr. Akins, he's put together a very diverse group of public sector professionals to serve as ambassadors in this program. And like Dr. Neely said, this evening there were 14 individuals who were recognized in the inaugural MPA Alumni Ambassadors, and they're really from a very broad spectrum in the different public sectors. And I think that's really important moving forward to be able to help meet the needs of the MPA program. Last month, the ambassadors came together as a group for the first time to kind of as an initial meet and greet and to get to know one another. But as we move forward and we have future meetings, I think we'll look to begin to build the foundation for this organization that'll really support and complement the existing efforts that are going on in the MPA program. With that, the purpose of really creating this organization was to establish a platform for the alumni to share their experience and knowledge of the MPA program and certificate programs out in the community. And really in doing so, they'd be able to help promote the degrees and certificates and help attract and recruit that top level of talent that we all know we need in the public sector. The ambassadors, they'd be there to connect with the students and future graduates as they become alumni. And I've already been asked to get the alumni tailgates going again as soon as we're able to meet one another. So those networking events that we haven't had in person or even online, we would look to kind of engage in some of those and get some of those activities started. But once some of those connections are made, helping those students get that internship, and then even maybe helping them find that first job, showing them where the opportunities are at. I think that's so important. We also have an opportunity to maybe get the mentorship program going again. I know there was a mentorship program established, and most certainly I think there's an opportunity there. There's also an opportunity to help assist the faculty as speakers in the classroom. And I know I've seen even a number of the panelists that were speaking tonight. I've seen you in some of the ICMA student chapters and speaking to the groups, and you've probably most certainly spoke, to a Dr. Daly human resource class as well. And that's needed, I think, to help, like Dr. Neely said, connect that alumni and student together and be able to share some of those professional experiences with them. But there were really a lot of opportunities for the alumni as we get this organization started, moving forward, and like Dr. Neely said as well, it's really kind of bringing a lot of the efforts that are already taking place together and formalizing that and in a coordinated effort to help support the MPA program. And I'm looking forward to taking that to the next level. Again, I'd like to thank Dr. Akins for all of his leadership in helping put this together, and all of the USF MPA staff. You're always great to work with. And also, I'm very much, again, looking forward to working with all of the other MPA Alumni Ambassadors. I think we've got a great group, and they're very willing to help in the MPA program. So with that, I'll turn it back over to Dr. Neely.
Dr. Neely, are you there?
I was just going to turn it back over to you.
Okay, thank you very much, Dr. Neely. We now move on to the presentation of scholarships, and I will now call upon Dr. Krista Remington to just, continue.
All right, good evening, everyone. I'm Krista Remington, and I'm an assistant professor at the School of Public Affairs. The School of Public Affairs, it's home to some of the best and brightest students that are aspiring to be the next generation of public leaders. I have probably the best job on the event tonight because I have the privilege of acknowledging some of our top students and awarding them one of our prestigious scholarships. So the first scholarship I would like to award tonight is the Jamil Jreisat Scholarship. That was named and established by the late Professor Jamil Jreisat. The scholarship rewards outstanding academic performances by graduate students in our MPA or public management programs. The scholarship is awarded to 2 deserving students who either submit an outstanding research paper in public administration or who has a 4.0 perfect GPA. So the first scholarship I would like to award tonight is to Sharon Hamasak, and she's being awarded for her 4.0 GPA. Sharon is the Director of Development for USF's College of Arts and Sciences. She hopes to graduate with her MPA in spring 2022 and continue on at USF in higher level leadership roles. For her 4.0 GPA, she's being awarded this scholarship. Congratulations, Sharon. We are so proud of you, and we wish you all the best as you pursue your career goals. The second recipient of the Jamil Jreisat Scholarship is Tiana Hill. Tiana is an accounts payable intern at DLA Piper and a graduate assistant at the University of South Florida. After graduation, she intends to work in the local government sector, focusing on county affairs and legislation. Her career goals are to become a city councilwoman, advocating for employment and housing equity. Based on her outstanding research paper, she's being awarded this scholarship. Congratulations, Tiana. We are proud of you, and we know that you have a bright future ahead. The next scholarship we would like to award tonight is the Pynes Memorial Scholarship in memory of the late Professor Dr. Joan Pynes. Before we do, we would like to recognize her husband, Mike McNaughton. Mike, are you on the call tonight?
Unfortunately, he is not.
Okay. So this scholarship was founded in the memory of late Professor Dr. Joan Pynes, and it rewards outstanding academic performances by graduate students in our MPA or Management of Nonprofit and Non-Governmental Organizations program. The scholarship is awarded to 1 deserving student who's interested in pursuing a career in nonprofit administration or NGO management. And this student must submit an outstanding project paper in nonprofit management. So tonight, I have the privilege of awarding the Pynes Memorial Scholarship to Philip McEwen. Philip is the Director of Development for USF's College of Nursing, which affords him the opportunity to give back to the profession that helped save his son's life. Working in the nonprofit arena is more fulfilling than he ever imagined. He hopes to continue making a difference in the lives of others by providing professional leadership to organizations that hold service to others as their highest ideal. Philip has shown outstanding academic ability in the area of nonprofit research and leadership. And because of this outstanding project paper, he's being awarded this scholarship. Congratulations, Philip. We're proud of you, and we wish you all the best as you pursue your career goals. The final scholarship we want to award tonight is the Ron and Libby Sanders Public Service Scholarship. Before we do, if Dr. Ron Sanders is on the call, we would like to invite him to say a few words about the scholarship.
I am on the call if you can hear me.
We can.
I won't take a lot of time because we've spent a lot already, but thanks to the two scholarship winners for the very nice letters. I hope you are going to be public servants this time next year. As all of you know, the purpose of the scholarship mainly focusing on our undergraduates, those with a minor in public service and leadership, to encourage them to take a career in public service, just as several of the speakers have mentioned. So I hope it serves as just enough of an incentive to get you all to do that. And I think with our two winners, they're already public service spirited. So I'm looking forward to working with them in the future. With that, over to you, Krista. And thanks for inviting me.
Excellent. So with that, I'll go ahead and present the Ron and Libby Sanders Public Service Scholarship. Sanders, he's the current staff director of USF's Florida Center for Cybersecurity and also the former director of the School of Public Affairs. This scholarship rewards outstanding academic achievement for an undergraduate student that hopes to pursue a career in the nonprofit, community-based, or government sector. So the first student we would like to recognize for this scholarship is Zach Blair Andrews. Zach is an honors student majoring in political science and minoring in public administration. He currently serves as the elected lieutenant governor of USF's student government on the Tampa campus. After he graduates from USF, he plans to pursue a master's degree in public administration, hopefully at USF, and work in the nonprofit and public sector. Congratulations, Zach. We are so proud of your achievements. Our second student we'd like to recognize tonight is Courtney Wilkerson. Courtney is a political science major with a minor in public service and leadership. She's currently an intern with Hillsborough County's Anti-Human Trafficking Project. She plans to attend graduate school and wants to work in the nonprofit sector, hopefully for an organization like Feeding America or Metropolitan Ministries. Congratulations, Courtney, on receiving the scholarship. We wish you all the best as you pursue your career goals. On behalf of the School of Public Affairs, I want to congratulate all of the recipients. We're so proud to have such excellent students in our program. Thank you. Back to you, Dr. Sanders, or Dr. Akins, excuse me.
Thank you, Dr. Remington. And I echo the statements of Dr. Remington. Congratulations to all the scholarship recipients, and a big congratulations to our new MPA Alumni Ambassadors as well. So we move on to the final activity on this program, and that is the induction of Pal Alpha Alpha. So Dr. Daly, if you are there, take it away.
Yes, I'm here. Good evening. Thank you, Stephen. Pi Alpha Alpha is the Global Honor Society for Public Affairs and Administration. Its purpose is to encourage and recognize outstanding scholarship and accomplishments in public affairs and administration. Pi Alpha Alpha members identify these with the highest professional level an educational program preparing them for public service careers. Induction into Pi Alpha Alpha at the University of South Florida requires a GPA of 3.7 or higher, completion of one's master's degree, and to be a person of high ethical and professional integrity. Nomination to Pi Alpha Alpha for MPA graduates meeting these induction standards also occurs following a vote of the faculty. And I will tell you that we have had a few cases in the past where the ethics has come into play. So we really are very serious about solid ethical standards and professional integrity. With that said, we are exceptionally proud of the 6 high-achieving individuals who are our 2021 Pi Alpha Alpha inductees. And I'm going to read a very brief bio on each. The first inductee is Rich Alvarez. Rich is a graduate in 2020. Rich is the CEO of Peacekeeper Initiative, a Pinellas County-based nonprofit organization dedicated to first responder behavioral health issues from job-related stress. He spent 15 years as a police officer, correction officer, and emergency medical technician. He attained his bachelor's degree with honors in nonprofit administration from Cleveland State University in 2015 and his MPA from USF again in 2020. So congratulations, Rich. Our second Pi Alpha Alpha inductee is Reginald Dagsa, class of 2019. Reginald is an officer in the U.S. Naval Reserve. Presently, he is assigned to the U.S. 5th Fleet Operations Staff in Manama, Bahrain. He receives his MPA from USF in 2019. Congratulations to you, Reginald. Third, Pi Alpha Alpha inductee, Samantha Genski Condon, of class of 2020. Samantha earned her bachelor's degree in psychology with a minor in criminal justice from the University of Wisconsin in 2013 and her MPA from USF in 2020. Performing in roles that help people has always been her passion. Congratulations, Samantha. Our fourth candidate for induction is Boniswa Joseph, class of 2020. And I have to say I'm very proud because Boniswa is a second generation USF MPA. Say hi to Ruby, your mom, for me if you would please. Ruby is a Tampa native and she received her MPA from USF in 2020. She aspires to work at the local city/county level to contribute to the financial stability and overall prosperity of her home community. And this would be a great candidate to hire if local government people are listening. She is gainfully employed, but she wants to get into local government, and by all means, go for it. Congratulations to you, Boniswa. Our fifth candidate is for induction is Michael McLaughlin, class of 2019. Michael earned his MPA degree from USF in 2019. Most of his work involves providing operational support, data analysis, and business consultation for healthcare providers. He is always looking for new challenges. Congratulations, Michael. Our final candidate, Nalia Ogunake, class of 2020. Nalia was born and raised in a single-parent household in Opelika, Florida. Despite the odds, she is a two-time graduate of USF, where she earned her bachelor's degree with honors in criminology and a minor in psychology in 2011, and her MPA in 2020. She currently serves as the department manager with Hillsborough County Public Schools. And I apologize if I butchered your name, but congratulations. We're very proud of you. Congratulations to all of you. And as I always remind the inductees, also congratulations to your families too, because they helped get you there for this highest academic achievement. We're very proud of you. Keep up the good work in the public service to your community. With that, I'll send it back to Dr. Akins.
Thank you very much, Dr. Daly, and congratulations to all the inductees. We are very proud of you. Before we wrap up, if you are here or you have an employee who really wants to pursue master's degree, please consider the USF Master of Public Administration program. We are still accepting applications for the fall admissions through June 1st, 2021. And as you can see on the screen, we have a link, that green box over there. When you click on the link, it will take you to the application page. So the GRE is waived for the 2021 fall admission cycle for individuals that have GPA of 3.0. If you don't have a GPA of 3.0, no problem. you can still, apply and get admitted to one of our certificate programs as a pathway to the MPA degree. And if you come out of the certificate program with the GPA of 3.5 or better, you get admitted to the MPA degree without the GRE. And guess what? All the courses that you take in the certificate program get transferred to the MPA, so you don't lose any time at all. We also, have scholarships that are at the back of or at the very last page of the program. And as you heard from the speakers and the recipients of the scholarship, this scholarship really, really, goes a long way in helping us to assist our students in meeting their educational needs. So if you are here and want to contribute to the scholarship, please, all you get to do is click on the title or picture by the scholarship of your choice, and it will take you to the page where you can contribute or donate to the scholarship. We also have the School of Public Affairs funds, and if you want to contribute to the fund, that would be really great too. To wrap up, I want to really thank our guest speaker and the panelists for sharing their knowledge and insights with us with regard to the kinds of measures that are being put in place to deal with the pandemic. We are very, very grateful for your time. I would also want to thank all the individuals that really work behind the scenes to make this event possible. We are really indebted to Ms. Annie Valdez and Kayla Duckworth for all the work they did. They really worked assiduously to make sure that all the I's are dotted and the T's are crossed. So Annie and Kayla, thank you very, very much. Finally, thank you to faculty and all the audience that joined us tonight. We are very, very grateful for your presence. We know you are busy, and for you to take time off your busy schedule to join us, we really, really appreciate that. Thank you, thank you, thank you. We are grateful. Good night, and please stay safe.